Shall we? Yeah. All right, fantastic. I'm going to dive straight in. Good morning. I'm Satchit Balsari. I'm an emergency physician. I'm faculty in emergency medicine and global health at Harvard. I am delighted to be here and that after spending 25 years in the Americas, my Spanish is terrible, so I'm very, very sorry. But technology is wonderful, and I'm glad there is live translation. So grateful for it. I was looking back at how we arrived at this moment, this conference about technology and data in emergency management. You know, as an emergency doctor, I'm very used to sitting at tabletop exercises and simulation exercises where typically police, fire, EMS, hospitals will sit together and prepare for disasters. That journey where data scientists and research analysts have now become so integral to this is quite remarkable and maybe worth reflecting on for a minute. 4 consequential years in our lives in the last 2 decades were between 2004 and 2007. Facebook was launched in 2004. In 2005, Google Maps was launched. In 2007, the iPhone was launched. You know, how we have communicated with each other as human beings, our relationship with information, with data has forever changed with those developments. OpenStreetMaps, in fact, was also launched in 2005 and ended up being very consequential in 2003, four. An average is good, so between 3 and 5, 2004. Which is just incredible. And so many of us remember those early days where we were using cell phones, there were no smartphones then, and text codes to try and get information from communities that were hard to reach. And despite the ubiquity of this data, when Nishant led a team in 2017 to Puerto Rico to study the impact of Hurricane Maria on the communities in Puerto Rico, Nishant and his team found that not just 62 people had died, as the US government was claiming, but probably closer to 4,000. And while that was in the news and everyone was shocked by that, what most people missed was the second figure in the article that Nishant's team published that said that the vast majority of people that had died because of some kind of interruption to healthcare. Either the hospitals were down and the doctors and nurses were not there, or the roads were down and they were not there, or people couldn't get out of their house, or they lost power. And yet in 2017, information about where all these people were, who the medically vulnerable were, which roads were closed, which power stations were not working, what medicines these people needed were available, but they were not available either with the patients or the communities or the healthcare systems or the emergency responders responsible for caring for these people. And the 4 panelists that we have today have tried to successfully change that at global scale. While Andy has been very generous in preparing everyone's bios for me, I think I will do such injustice to their bios, and rather than read out what their institutional affiliations is, I'm going to request each speaker to see a little bit about how they arrived at what they're doing, sort of in brief, a biography of their journey, if you will, rather than their academic credentials. I want to begin with Celine Jaquin, because OpenStreetMaps has been the oldest player in this journey. And from a motley crew of volunteers on the streets of Haiti, you know, many decades ago, to this global network of volunteers, and to sustain this global network of volunteers and provide such rich data to responders all over the world is a really magnificent task. And honor to meet Celine and honor to welcome you to start the day.
Is it okay if I speak in Spanish? Bien, estamos resolviendo la proyección del PowerPoint, pero voy a iniciar de todas maneras. Soy Celine Jaquin, soy la gerente regional América Latina y Caribe del equipo humanitario de OpenStreetMap. Esta organización, Humanitarian OpenStreetMap Team, es una ONG que nació justamente a partir del desastre de Haití en 2010, donde es la primera vez que se pudo conocer y ver y experimentar y tener efectos inmediatos de la cartografía colaborativa en OpenStreetMap para responder a una emergencia, ¿no? Entonces, a partir de ahí se construyó la organización. Hoy día, entonces, es una organización que sigue realizando este tipo de apoyos, movilizando una comunidad que es una de las más grandes comunidades de ciencia ciudadana, que se compara muchas veces con la de Wikipedia, ¿no? Y Wikimedia en general. Es inmensa, son 12 millones de personas en el mundo, no es poca cosa, ¿no? Y no van a participar necesariamente 12 millones de personas en cada llamado, pero sí cientos y miles de personas, dependiendo del interés que puedan ver en aportar su participación. Entonces, HOT se ha especializado en movilizar este enorme potencial de cartografía para asuntos de emergencia y desde hace algunos años para otros asuntos un poco más vinculados con el desarrollo sostenible y mucho de lo que estamos ahora trabajando con varios gobiernos de la región, la cartografía de anticipación, para no solo buscar generar la información cartográfica faltante en el momento después de un desastre, pero pues ya prever, ¿no? Prever un poco más en espacios donde los gobiernos de todas maneras no logran movilizar los recursos suficientes para hacerlo ellos mismos. Entonces ahí está el espacio, la brecha donde puede aportar la sociedad civil organizada y pues toda esa población participante universitaria, civil, etc. Entonces, bueno, un primer punto importante efectivamente es ayudar en la resiliencia a las catástrofes naturales, generar una cartografía con un enfoque inclusivo. ¿Esto qué significa? Eso es bien importante porque las cartografías que existen, las oficiales, y es más evidente con las cartografías comerciales, se producen con una mirada específica sobre el territorio y un interés concreto, ¿no? El interés para cartografías comerciales pues, es generar negocio, ¿no? Pocas cartografías existen con una mirada de las mismas poblaciones, entonces el saber local, que no solo es necesario para saber cómo están los objetos del territorio, si existen, si ya no existen, en qué condiciones están, pero también los intereses de estos mismos habitantes, qué tipo de equipamientos les interesa más, ¿no? Entonces siempre vamos a ver en una cartografía colaborativa un acento fuerte en equipamientos culturales, religiosos, comunitarios, ¿no? Y esos son también equipamientos bien importantes en momentos de emergencia, porque justamente ahí están pilares comunitarios, liderazgos comunitarios, que ayudan la mayoría del tiempo en la recuperación. Y un tercer punto en torno al que trabajamos es reforzar los liderazgos locales. Entonces, movilizando esas comunidades mapeadoras, que son globales, también siempre movilizamos las que conocemos en los países, entonces comunidades más nacionales o completamente locales del estado, del departamento, y construimos, si no las hay, y buscamos generar liderazgos. Al rato platicaremos más del caso de Otis en México, cómo ha sido bien importante movilizar la Universidad de Guerrero, específicamente el Departamento de Geografía, vincularlo en una red de otros departamentos de geografía del país, que se generen ahí vinculación, ganas de trabajar, ganas de hacer más cosas, y eso siempre hará que será más fácil movilizar estas redes, estas comunidades cuando se requiera para otra emergencia. Entonces los liderazgos son bien importantes. También platicarnos en el caso de Otis que desgraciadamente, pero afortunadamente, el que llegue otro desastre un año después hace que esa movilización todavía está viva y eso facilitó bastante actividad rápida, ¿no? Les presento pues un poco el mapa, solo porque es bonito y es impactante ver, pero de Haití, donde empezó todo. Entonces, en enero 2010 sucede el temblor y los datos que vemos a la izquierda son los que existían en el mapa de OpenStreetMap. El mapa de Google era mucho más pobre aún, ¿no? Entonces, a lo mejor el contraste no nos permite ver bien a detalle, pero bueno, estaban en algunas vías principales un par de áreas verdes y un puntito por ahí, y eso es todo. Mucha gente que ya colaboraba en OpenStreetMap ya estaba vinculada con el sector humanitario. Entonces, esas personas de muchos lados empezaron a mapear en OpenStreetMap, que era un proyecto relativamente joven aún. Y el interés y la movilización fue tan exitosa, que se decidió a partir de ahí inventar el concepto de activaciones de emergencias, donde pues se invitaría ya formalmente a esa gran comunidad de OpenStreetMap, después de cada desastre, a mapear todos juntos muy rápido. Desde el instante que sucede el desastre, ya nos ponemos a mapear en un área definida con los expertos que están en campo, donde la acción lo requiere, y pues súper rápido mapean. Entonces en Haití en 2 días ya había mucho mapa, y 3 semanas después había un nivel de detalle impresionante que hace que hoy día Haití tiene la mejor cartografía de todo el Caribe. Bien, entonces, actividades que hacemos. Hacemos desde esos 2-3 años mapeos anticipatorios en varios países. Inició con Ecuador hace 2 años, y esos mapatones ampliados que duran varios meses con varias sesiones a la semana, se los han apropiado los gobiernos, ¿no? Las autoridades nacionales. Entonces, en el caso de Ecuador, la Secretaría Nacional de Gestión de Riesgo de Desastre. Luego empezamos a colaborar con Perú, donde fue con la Agencia Espacial, pero la Agencia Espacial ya tenía colaboración en torno a esos mapatones con varios ministerios, entre cuales el de Vivienda. Recién hemos empezado también el mismo mapatón en Colombia con la Unidad Nacional de Gestión de Riesgo de Desastre y el IGAC, que es el Instituto Nacional de Geografía. En México hemos estado en conversaciones, y bueno, espero que el año que viene lo lograremos realizar también. Hay también interés del INEGI, de Senapred, y bueno. Entonces, la idea es que año tras año se vuelva una iniciativa que la gente ubique muy bien, que atraiga interés, que ese interés de organizaciones, empresas y comunidades lo vuelva aún más atractivo para la comunidad mapeadora, y que haya más y más mapeo, y se mapean las áreas de alta vulnerabilidad ya identificadas por los gobiernos, ¿no? Otro proceso un poco más cercano a gobiernos locales con este mapeo anticipatorio es el trabajo con gobiernos locales muy en particular, y un ejemplo fue en Tulum, donde se estaba hace 2 años actualizando el Atlas Local de Riesgo, que pues sabemos que en México todavía hay una gran necesidad de actualización, incluso de creación de atlases locales. Entonces, ahí se trabajó con el gobierno, se incluyeron las 30 localidades que componen ese municipio, no solo es la ciudad de Tulum, y son localidades muy rezagadas, ¿no? Hay localidades donde la gente ni siquiera habla español, entonces generalmente estaban ignoradas por su gobierno. Y otras cartografías anticipatorias de áreas pues como faldas de volcanes, costas, donde se reciben huracanes con cierta frecuencia. Luego, la respuesta a emergencia, que pues ya lo comenté bastante. Luego, mapatones comunitarios y mapatones con comunidades de residentes, donde vamos a campo, capacitamos comunidades sobre diferentes herramientas y metodologías de la comprensión del espacio y de la sistematización de la información sobre su territorio. Esto permitiendo varias cosas, permitiendo que estas comunidades, muchas veces son comunidades rurales, aisladas, indígenas, puedan empezar a ser un actor activo, vaya la redundancia, de su planeación territorial, y luego que se vuelva también un colaborador informado con su gobierno para la planeación territorial local y para la respuesta a gestión la respuesta a desastres. En Colombia, el mapatón anual que hemos hecho era justamente en preparación de salidas a comunidades, que iba a ser la unidad, para enseñar a las comunidades a tener mayor preparación y conceptos de prevención y protección civil. Entonces, el tener la cartografía previa permitía ya empezar a preparar este trabajo, ¿no? Esa es un poco la idea. Bueno, estos son los mapatones nacionales, que ya mencioné. Súper rápidamente, en el Río Grande do Sul, el año, por ahí entre mayo y julio, estuvimos trabajando ahí de varias maneras. Una, la activación de la cartografía, entonces se cartografió unas 30 municipios del estado de Río Grande do Sul. Hemos colaborado con la prefectura de Porto Alegre en procesos más finos, más complejos, más de gestión de recursos, donde también se requieren muchas veces datos, assessments diagnósticos de daños y muchas otras cosas, y un gobierno dentro de una situación de crisis no logra ocuparse de todo. Entonces ahí el apoyo fue metodológico, aportándoles tecnologías abiertas que facilitaran también la salida de los silos de información, que eso es un obstáculo tremendo en todos los niveles de administración, y en una ciudad, en un momento de crisis, es terrible. Puede hacer que pase un mes sin poder hacer nada porque una dirección no pasa los datos a la otra, no tienen los formatos, etc. Y con la ciudad de Porto Alegre también, y eso permitió que gestionara con el BID y con los fondos de emergencia una mejor transmisión de recursos. Después de eso, estaremos construyendo con ellos una metodología participativa de vigilancia del avance de las obras de recuperación, y eso para los equipamientos más esenciales, que como se mencionó antes, de salud, atención de salud, educación, etcétera. Y lo puedo dejar ahí por el momento. Muchas gracias.
Thank you. We'll jump right to Alex. Just a quick 1 minute about you and just your journey to do this. And you come at this from such a different vantage point, right? OSM is crowdsourced. It's very grounds up, and you work one of the largest technology companies in the world and are able to essentially push down these products at scale. Why follow the path that you have? So much of your data is so readily available. You make fairly concerted efforts to go seek out researchers and community partners to work with. So just a little bit of framing as well. We may not have time to come back to a second round, and so both the product and then how you work.
Thank you so much, Satchit. Also, as mentioned, I'm from the United States, so I've spent my entire life in the Americas, and I must apologize that I don't have Spanish skills to speak to you, so we're aided by the lovely translation. My journey, I was a physicist, then I started working in the humanitarian space, and then ended up in the private sector. I work on a team at Meta called Data for Good. I'm a research manager there, which is maybe just some other word for a data scientist. And so I'm not necessarily an expert in the crisis response space, the types of data, or similar, like if we're using human mobility data, I'm not a public health expert. My expertise is in the privacy protections we apply to the data sets, so that when we make data available that comes from the platforms powering over 3 billion users a day, that we are confident that we are using this data and it is ethical to do so. As mentioned, the program Data for Good has begun around 2017, and it has always started as this place where you all, the experts, define the problems for us. And then we work together then to compare the privacy protections needed for the data to be ethically shared so that we can move towards social impact. And in the case of crisis response, I think it is safe to say that it is saving lives is our goal. Here you can see on the screen the entire menu of our program's offerings. We will not have time to go through all of them today, but there should be ample opportunities across the next 2 days for us to discuss in detail. And I think a key aspect of the partnership model that you see here is that on the top half of this robust menu of data sets, these are fully publicly available data sets. So these are data sets that either are not using any Meta user data whatsoever. They are derived often from remote sensing data from satellite imagery, or from crowdsourced street level imagery to build out this top layer of physical infrastructure, human settlement, estimates of poverty and wealth. Or one of our most recent releases is the height of all trees on Earth. And the second row details data sets that are derived from the Meta. In this case, all of these are Facebook users, but we are able to apply what is a robust differential privacy framework. And this is a way of kind of statistically scoring the re-identification risk within a data set in a very precise and meaningful way. And this can be audited such that we strive for this, what is called like differential privacy epsilon value of 1.0, whereby the proportion of noise in an aggregation is proportional to the maximum impact that a single individual could make. And the applied reality of that type of noise and privacy protection means that it should be impossible for an adversary to identify if any single individual is even present in the data set or not. We don't even need to speak about what their particular data looks like within the data set. Or what we also are able to do in the cases of crisis response, where the privacy ethics and things might be a bit looser, and because it is a life and death situation, you see this in the bottom half of the menu shown here. So these data sets are not fully publicly available. These are only available under to trusted partners like CrisisReady, both on the research and the humanitarian implementers side. We wish to empower their work with new data sources. They are able to then to triangulate it against more traditional data sources or local know-how and bring, it is just one piece of the puzzle. It would be a massive disservice if a private sector entity with like large reputation, big name, suddenly comes in and takes all of the headlines or takes all of the attention of these complex crisis response relationships. It is not typical in Silicon Valley for us to say this, but it is our hope not to be disrupting those relationships, but in empowering the specific actors who have many years of trust and local knowledge to bring into this paradigm. And so those data sets have also robust privacy protections in the aggregation and noise, but also the protections of a legal framework by which the data is shared and allowed derivatives can be shared. And so I think in closing, this is maybe a key hallmark to highlight in the way that the program forms partnerships. We would admit that this limits scale. Those data sets on the top are the ones that anyone on Earth can go to UN OCHA's Humanitarian Data Exchange, and they are designed to be more quickly interpretable and to make quick decisions at any level of a response. But then we also have these more targeted and surgical data sets that are designed with the input of, we call them like our beta partners. For each of the data sets you see here, we would recognize maybe 2 to 3 organizations, usually spanning the academic research community, the humanitarian organizations themselves like Direct Relief. They are the ones defining that problem space. They are the experts in that space, and they are the experts in how data can be deployed locally for the response to saving lives. And we must respect that role. We at the data provider in this instance are sitting in an area of extreme comfort. We are not at risk. Our users are in those places, so we definitely want to empower this work, but it is not for us to come in and disrupt that and be offering these. So they're all provided for free, and it is a constant feedback cycle. And again, this oftentimes can limit our ability to scale, but the ability to come in person to meetings and workshops like these, and also for our program to offer one-on-one support through community messaging on Slack, WhatsApp, email. That availability, that very human element, while it does limit the ability to scale quickly, has been absolutely critical to the program, and I look forward to seeing it continue. So I think I will close there for now, but look forward to learning more with you all over the next day and 2.
Alex, thank you. And I want to acknowledge just this last point that you raised about the human in the loop. It is not something that most of us would assume comes with these technologies, but at CrisisReady, we've had a firsthand response, firsthand experience with texting Alex many times an hour in the middle of a disaster as we're trying to stand up the dashboard. So thank you kindly. Over to Professor Caroline Buckee. Caroline, if you could just say a couple of things about your journey as an epidemiologist studying malaria to tracking everyone's cell phones all over the world, and the work done at the COVID-19 Mobility Data Network in CrisisReady. I had requested Alex to leave some time for you to talk about mobility data as a different stream of data from the kinds of data sets that have been presented so far. So a little emphasis and background on that would be very helpful. Thank you.
Thank you. Can you hear me okay?
You're muted.
Yeah?
You're muted either at your end or our end.
Not at my end.
Say something.
Can you hear me now? Can you hear me?
I can hear you on Zoom, Caroline. Yeah. I don't know if they can hear us.
I'm not muted on my end then.
Mm-hmm.
Here or there, but not here. Yeah, it's not a Caroline. The problem's not at your end.
Can you hear me now?
Yes.
Okay, great. Thank you. I will add to the chorus of apologies. I could speak in Spanish, but I promise you nobody wants to hear that. So I'm going to talk about the work that we do at CrisisReady, but I'm going to start from my background. I'm an infectious disease epidemiologist. And later today, we will talk about dengue outbreaks and how we might use analytics and modeling to do a better job of preparing for and responding to them. But I've worked with control programs for many years. And in the context of novel data streams, we use everything from pathogen genomics, like wastewater surveillance and strain typing, all the way through to mobile phone data, mobility data sets. And a general observation across public health spheres is that the landscape of the types of data that we can use for surveillance and for enhanced response is changing very quickly, largely due to private data streams such as those that Alex was talking about just recently. So if we just look at these two figures here, that's Cambodia on the left, and you're looking at the distribution of malaria cases across the country. Control programs have historically built up these kinds of data sets from clinics and hospitals around the country. And the equivalent in disaster response is, trying to understand who's affected, which are the populations at risk. On the right, you can see Bangladesh. And this is from a study that we did with nearly 65 million mobile phone subscribers and the data that they generated as they moved out of the capital, Dhaka, during the Eid holiday to the rest of the country, inadvertently spreading chikungunya as they went. And we've been using these data sets to understand and predict how epidemics will spread due to human mobility for about 15 years now. And when Satchit and Nishant and I worked on the Hurricane Maria study, it became apparent that these population mobility data sets were incredibly important in the context of displacement and evacuation following extreme weather events as well. And so my path has been from using mobility data in the context of infectious disease forecasting and then shifting into trying to understand how people are moving around after disasters. And the catalyzing event was COVID-19. So when, in an unprecedented way, the whole world locked down and governments started to need to be able to monitor whether lockdowns were working and where the disease may spread next, suddenly these data sets on where people were, where they were moving, if they were moving, and mobility between locations became incredibly important. So we built up a network mostly of infectious disease epidemiologists to help local governments in both gain access to this data, but also analyze it in a way that was useful for them to answer very specific problems. And I think this is the lesson from COVID-19, at least from my perspective. It's that these innovations in AI, data, modeling, and analytics, they do not work to actually change things on the ground unless they are combined with contextually relevant information. they have the right analytical processing on the right spatial and temporal scales, and there is a partner on the ground who wants to look at that information and make a decision differently because of it. And so at CrisisReady, we've built out this kind of pipeline idea where to be genuinely ready for a crisis, first you need all of those different data sets that might be helpful for surveillance when a disaster happens. That requires all kinds of agreements in place. You need to know what data you have to have and all of those kinds of things. And then you need appropriate analytic pipelines. Much of the work that people do in academia is not actually on the right scale to make a decision on the ground. So we have to be very careful not to be taken in by the promise of AI and modeling, and to really make sure that the methods that we're applying to data sets are going to support directly the decisions that first responders have to make. And then translational readiness really requires people who are responding who either have connections to academics or other partners, or they have the capacity in-house to understand what those inputs mean for them and to use it to make a decision better. And I think all across this pipeline, we have complex economic capacity considerations, as well as this issue of who actually looks at the information and what do they do with it. So at CrisisReady, we have this pipeline, and we've responded to many different disasters. And the idea is that first we use data that we can to map the landscape of vulnerabilities and make sure that we have the data processing capacity in place before the disaster hits. So in this example, we may want to know the disaster perimeter, what vulnerabilities exist, Satchit mentioned, elderly or people dependent on electricity. We may want to know about infrastructure like healthcare and the grid. And then on top of that, in real time, we want to be able to analyze what's happening with population mobility. So we've developed a platform called ReadyMapper, and I'll show you some of these maps on the next slide. But the idea is that this should be a tool, these kinds of tools should be developed in close partnerships with the implementing partners so that we can have an iterative process of understanding what they need. These pictures here are just an example of the PDFs that can be printed off as we produce these situation reports each day. This particular tool called ReadyMapper, which Satchit and Andrew can show you examples of later, we have different data layers that can be toggled on and off. This is an example from the Dixie Fire, the wildfire in California, where we have different data layers that the responding teams can look at, can turn on and off. And as the crisis unfolds, the map changes to accommodate new information going into the back end. So for example, this shows the different population vulnerabilities in the areas affected. Here we see a map of how people are moving in response. So the red dots show where people are leaving, the blue dots show where those people are going to. And this can help us to inform hospitals and know if they should be receiving more patients than usual. And then we may want to know about which healthcare facilities are active, how many beds they have available, and so on. All of these pieces of data, none of this is rocket science per se, right? It's just about having the right data in the right format at the right time and making sure that the responding agencies have access to it. So one of the critical features here, and Satchit mentioned it before, is that for this to work, you need this critical gap here, this blue person that we've called a data translator. And we found that no matter how advanced your analytic capacity is, no matter how well your AI functions, without these key people who understand the context, can talk the different languages of operations and academic data science, without those key people, these new innovations often fall down and don't get translated for crisis response. And so we see the necessary requirement for being ready for disasters as a distributed network of capacity that can respond in time and can make sure that the right data gets to the right people at the end of the day. So I'll stop there in the interest of time, and we can discuss later. Thank you for having me.
Caroline, thank you. Professor Takahiro Yabe, may I welcome you to join us?
Yep. Can you hear me, Satchit?
Yes, very clearly.
Okay,
Taka.
perfect.
So Taka was invited to speak last because chronologically he is definitely the future, both of the field and of our community as well. But some of the work that his lab has been doing at New York University is really where we hope that the simulation exercises that I talked about right at the beginning, the tabletop we talked about, make standard practice, right? So Taka, believe we'll be sharing some of your work, the toolkit you prepared with the World Bank, but then also how y'all have been integrating synthetic data into advancing some of this research.
Mhm. Cool, thank you. Let me share my screen. Okay, Satchit, can you see the screen?
It is, yes, now we can.
Perfect. Thank you so much. And thank you so much for having me here today. And I'm sorry I couldn't be there in person. I was there a couple of years ago, and I really enjoyed being in Mexico City. So I hope I can visit sometime soon. So hi, everybody. I'm Takahiro Yabe. People call me Taka. I'm an assistant professor at NYU, and I thought I would start off by talking about some of the journey, what got me into this this field of disaster mobility analytics. This was during my the Kumamoto earthquake, which happened in 2016. Was a really big earthquake, magnitude 7.0. This happened during my master's degree. So while I was writing my master's thesis, this disaster happened, and naturally, I was doing analysis of mobility data. Naturally, my thought was, can I do something about to help the response and recovery to this earthquake? So this was a major event that got me into this field. What we ended up doing with while discussing with the city government of Kumamoto was to create real-time mapping of evacuation hotspots. So this was a joint effort with Yahoo Japan, which is the biggest IT company in Japan, and who was a longtime collaborator. So we managed to create these maps in a 3-day turnaround, which was quite a lot of no sleep nights for me. But we were able to identify what was called hidden evacuation shelters during the earthquake. So there was a lot of government designated shelters, but then there were places where people gathered despite the government not designating those locations as shelters, like parking lots of shopping malls, things like that. So this was quite successful in the sense that we were able to communicate with the city government and deliver these maps in near real time. And so this got me into the field of mobility analytics. We continued our work with the World Bank, scaling the efforts globally to different contexts and different applications. So we looked at cyclone impacts in Chennai, India, how people commute in and out the central areas of Kathmandu in Nepal, and also how people use different areas of the city differently. So the land use analysis in San Juan, Costa Rica. So we've been, the goal here was to apply these methods and also at the same time develop new methods that we can apply to different contexts and different problem settings. And one, as Satchit kindly mentioned, one goal that our lab at NYU were striving towards is to try to enhance human mobility research. Of course, the technical advances, but also to try to make this field in general more open with open source code and also standardized data sets. So this is an article we just wrote together with some of my collaborators a couple months ago. And I'll show you 2 things that we're doing right now to kind of achieve this major goal. So one thing that we did with the World Bank was to create open source toolkits or Python code toolkits to enable the analysis of all the things that I've just mentioned using mobile phone or mobility data. So this figure is showing how we can use this for rapid assessments of population displacements in Mexico City using a case study from the Puebla earthquake, which happened years ago. We managed to make the toolkit open source, completely open source. It's called MobileKit. You can, if you're a Python user or if you're familiar with Python code, you can try to install this library using pip install MobileKit. It's just one line of your code. And then you'll, if you're a trained data scientist, you'll be able to use some of this code for analytics using your proprietary data. So we've been developing some of these open source codes together with our collaborators. Also, the second branch of this research is to develop open data sets. And one way to do this is to create synthetic human mobility data, especially during disasters. So as you may know, there's many issues or challenges with current data. One that is proprietary, and also they have a lot of risks, as some of the speakers have mentioned so far. So what we're aiming to do is to develop algorithms that can create synthetic, meaning they're not real, but they mimic the actual patterns of how people move or behave of human mobility data and make them open. So this is a snapshot of what the synthetic data looks like, but it should look like the real movements of people. And we can use these kind of simulations to answer questions like, how would people evacuate if New York City had a major hurricane? And one pushing forward, this is the last slide that I want to share. We're trying to achieve in our project, push this idea further to obtain data from different disasters that happen in different geographies to create a synthetic mobility data set that is generated from all of these scenarios to achieve collective learning so that we can tackle questions like, what if Boston, which has never had a hurricane before, how would people react to that if there's an unprecedented hurricane? Another set of research questions in this project is to answer things like to think about what are the appropriate data governance mechanisms to enable safe, transparent, and democratic sharing of this data, and how can we work with community stakeholders like the New York City government to make this more connect this to policymaking. So that's a really quick run through my career, I guess, but I'll push it back to you, Satish. Thank you.
Thank you, Taco. We have about, and you finished right on time, so thank you. We have about 13 minutes, and I want to leave at least 9 minutes for questions in the room, and a privilege of spilling over for 2 minutes because we started 2 minutes late. But I want to ask each of the speakers one last question. Please just take a minute or two. First, as an observation that each of you was presenting technology and data, and yet almost each of you concluded with the salience, and you did as well, Alex, with the salience of humans in the loop, right? Impact here is important. You care about how the products are used, how they're used responsibly, how they're used effectively. What does success look like for you in the next 5 years? At the speed at which technology is evolving, I hesitate to say 5 years.
Yeah, happy to kick off. I think one of the main trends that we've seen, and I would say COVID-19 definitely accelerated this trend, is that the prevalence and availability of different flavors of our program's mobility data was useful for very niche use cases, but there remains this sort of inherent privacy concern. So it's sort of an odd thing when you sign up for your Facebook account, there's this terms of service that very few people read all the way, but inside there is a mention that, yeah, your data, if you choose to share your location services data with us, we aggregate it, we apply and we try and explain this in common language, that it is privacy protected and it is shared with organizations like CrisisReady, and then we provide links so that they can see these use cases. So the first of 3 things I'd like to mention in the next 5 years, I would consider it an enormous success if instead of sort of burying that in some place where no one is finding it, that it was a place where, you know, if a crisis is hit, there's this Facebook feature where you are asked, it's called safety check. Like, would you like to mark yourself as safe, yes or no? And would you like to share that with your friends and family so that you don't need to answer the same question over and over to them? Like, yeah, I'm fine, I'm okay. Why not also offer the opportunity for people to opt in? Hey, if you would like, even if you are safe, you can contribute some GPS data. It is not individualized. We will add this noise to it and it will be aggregated and it will go to aiding the humanitarian response. And I think this is an ethos that we see very strongly out of the humanitarian OpenStreetMap example, where there is this very, you know, conscious contribution to a crisis response, and how empowering that might be when more citizens are aware that their data is used in that way, and something that everyone could be very proud of. The second place that I see enormous opportunity in the next 5 years is to borrow on the synthetic data scenario. So we have already done significant testing on synthetic data for survey responses within our program. And one of the very nice features of these synthetic data libraries is that you can tune the privacy noise parameters. So if you're essentially asking an algorithm to estimate what it is trained by real data, but its outputs are synthetic, they are simulations, you can sort of tell it how often you want it to be lying or adding how much noise you add to this. And so this is also a very nice way to kind of take this abstract concept or very statistical concept of differential privacy and compare inputs and outputs, which I think is more meaningful for humanitarian responders than the underlying like very deep mathematical statistics. So as we move into, you know, this, like I said, has been done and tested quite a bit in survey responses, kind of akin to census responses. Moving this into a mobility data space, I'm enormously optimistic for. And then the third would be as Meta and other private sector companies begin to build more and more wearable devices that like eyeglasses and things that foresee an augmented reality future where you would be, you know, able to navigate yourself around a place or things. These all require enormous amounts of geospatial data in order to power those experiences that largely come on the backs of the rapid advances in AI. And so the large language models are able to take enormous amounts of unstructured text data that come from OpenStreetMap or business pages on Facebook or a whole host of other applications that come from the private sector. But because it is designed to arm these user experiences on a new paradigm of hardware, we must make sure that these advances are also brought to fore in understanding the physical world and infrastructure and how this changes rapidly over time in crisis response. So I think there will be you know, a lot of runoff and exhaust that comes from the AI tools that are building those product experiences that we as humanitarians stand to benefit from as well. And they will all be done in open formats at Meta. And we hope that that's a bastion that leads other private sector companies to embrace open data and open models as well.
Thank you, Alex. My life was a lot simpler when, to prepare for disasters, all I had to sit with the police chief and the fire chief. Caroline, you're next, then Takahiro will end with Celine, the last word, and then open to the audience. Caroline, all the donors want to know how your work is going to save millions of lives.
So unfortunately, something that donors don't like to hear, and something that I think all the AI in the world cannot save us from, is the need to train and financially support people who can actually do this work effectively in local contexts. So for me, in terms of, you know, how you change the world, I think absolutely critical, because the AI tools are evolving very quickly, and technology and data now, I think, is not the limiting factor. It's very easy for us to sit here at Harvard and make complicated models and simulations, and that's great. The way to translate that into the real world is to make sure that there are these data translators. There are people who understand how to use this. They are trained. They know where the data is. They know how to interpret it. And they are embedded in agencies who can use it to respond. I think that is going to be the biggest bottleneck. And so success for me is the development and emergence of a network of people and funding and support for those people to learn from each other, to learn across case studies, to use all this data in a way that's actually effective for response. So for me, it's about the people and the network of people that are able to do this well in context.
Amen. Taka, you have 1 minute to translate everything on the whiteboard behind you.
Oh yeah, okay. I'll try my best. So thanks, Satchit. One thing so beyond all the things that I presented just now about developing advanced models for predicting human mobility, that I think what Caroline mentioned is key. So my success would be, after we develop all these models, bringing it back to the community stakeholders, having a good interface for non-experts, policymakers who can take this data, take this output, and really tune it and use it for their own to answer their key critical questions, is something that I would see success. And right now we're working in the lab creating these models, but if we can have a more kind of community-based bottom-up approach in terms of really adopting these foundational models and bringing it to their problem context and helping them actually drive their problems, solving the problems that they have in their communities using this type of data, using these type of models. I think if we can bring these models out of the academic system and back to the people who can use these kind of models to solve their challenges, I think that's a success for me. So having more of these interactions with community partners is something that I'm working on right now. So.
Thank you, Taka. That's a great segue to Celine, because trust is really at the essence of why HOTOSM has worked, right? Humanitarian OpenStreetMap works because it's about people, it's about citizen science. So last word.
Yo invitaría a todos a pensar el potencial de aporte de la ciencia ciudadana en torno a OpenStreetMap, pero no solamente, articulado con la inteligencia artificial y otras innovaciones que estemos haciendo, ¿no? Es algo que comento mucho a los aliados todo el tiempo. Formemos grupos de estudiantes para entrenar y mejorar la capacidad de la AI a reconocer objetos complejos. HOT ha estado, apenas está soltando un producto que se llama FAIR, que es un Open Code AI tool for mapping, que permite justamente desarrollar modelos para espacios muy específicos con objetos espaciales muy específicos. Por ejemplo, es muy difícil para todos automatizar el reconocimiento de edificios en zonas de slum, ¿no? De espacios en cerros, con una urbanización edificio sobre edificio. Eso nadie lo puede solucionar, creo, al día de hoy, ¿no? Entonces hay que poner a personas a trabajar, personas humanas, a trabajar junto con la inteligencia artificial. Hay todavía mucho que hacer en el reconocimiento de caminos por la AI. Reconocer usos de suelo, ¿no? Entonces son cosas sobre lo que trabajamos en conjunto en zonas de alta vulnerabilidad y sería muy bueno que varios actores pudiéramos colaborar en ello, pues aportando recursos, siempre hay algo bien importante al trabajar con comunidades, es lograr motivarles dándoles visibilidad. A un estudiante no es lo mismo decirle, bueno, quiero formar un grupo y te daré un sello de HOT o de la universidad y ya. Al decirle, pues tendrás un comprobante con sello de CrisisReady, Harvard, la NASA, Meta, ¿no? ¿Qué sé yo? Con eso podemos juntar 1000 personas en lugar de 5. Entonces, tenemos que pensar de esta manera. La ciencia ciudadana es movilizar personas y las personas pueden hacer bastante.
Sí, qué bueno que pude escuchar esto que comenta Celine, porque es muy importante integrar y sumar esfuerzos. A mí me gustaría comentar que acabamos de firmar un convenio con 39 escuelas y universidades que tienen programas académicos de gestión de riesgos y protección civil. Entonces se me ocurre, está la UAGRO, por ejemplo, la Universidad Autónoma de Guerrero, y yo creo que en el marco de esta red de universidades podemos plantear ahí un proyecto que se sumen a este mapeo e identificación con los estudiantes, que les sirve para servicio social, que les sirve para prácticas profesionales. Entonces ya lo anoté para ver qué organizamos.
Solo 10 segundos más. Estuvimos muy impresionados en una reciente activación que hicimos con el gobierno de Guatemala, donde PNUD Guatemala pensó, ¿y por qué no hacemos la convocatoria de la cartografía a través de UN Volunteers, en lugar de solo en redes sociales? La asistencia y la participación fue tremendísima. Queríamos mapear un municipio y mapearon todo el país y todavía les tuvimos que dar otro país que mapear porque tenían otra semana que cumplir. Y en 3 semanas mapearon todos los caminos de Guatemala y fue muy difícil gestionar tanta gente porque no lo esperábamos, ¿no? Entonces, pensemos esos canales, esas etiquetas que le ponemos a las convocatorias.
Please, yeah.
Yeah, and I just want to add, hablo en español, en español, porque how many minutes do I have?
That's the next panel. We're already
I know.
10:30, so.
Right.
Into the AI.
Very quickly, I will just add to what Celine and Enrique was saying. We were working
Yes.
greatly with Senapred, and we also work with the UNIRED, which are like 32 universities around the country, and also other ones. We are from the SENACED. It's a National Center for Supporting Epidemiological Contingencies and Disasters. We're basically a private sector initiative, which represents in Mexico two global initiatives from the United Nations, which are the Connecting Business Initiative and also the RISE at local level. So we are working with different universities, and also UNDP is one of our champions. So we can talk and perhaps replicate that good practice. And 2 questions very quickly for the panelists. How do you collaborate with the governments for the EDANs in Mexico, for the assessments for necessities of local communities? And also, we recently been trained for VOCs in Filipinas. And I would like to know, because they were presenting a lot of platforms, like open platforms, but how do they communicate? Because sometimes we have to report or do a mapping for the United Nations as a United Nations initiative. Sometimes we work, for instance, at HOTOSM, we start working in a mapping committee with Celine and other allies, right? So how do those platforms communicate? How are we doing it easily, as Alex was saying, like just to reach one place and have the right information to take the right decisions?
That's great, thank you. Can I direct that question about government partnerships specifically to Alex, because it's most relevant to meta products?
Yeah, I think since what typically happens in a deployment or things, of course, everyone is different in things, but oftentimes the government will reach out to Meta and say, like, we need your help on anything. And it usually starts, the idea is to how more efficiently to engage with the citizenry. So how to get messages out. So like, we have messages going out on radio, television, we also want them going out on social media. And then we also make them aware of the Data for Good program. But as I mentioned, we're not trying to displace this relationship with the humanitarian actors who have been involved long before our program started in 2017. And so we can say 2 things. We say, we have these public data sets that are kind of base level. They're, in the case of mobility, very, very simple to interpret, but thus there won't be much added value, but at least something. And this comes out of the COVID-19 experience, that we want to offer at least some base level of understanding of how human mobility in the present compares to the baseline before the crisis. But then the most important thing is that we are able to point to if you are working with humanitarian organizations or universities, you can put us in touch with them. Our team, even though we are data scientists, actually, I often joke, but there's truth to it. The most amazing aspect of this program is that the data license agreement for those controlled access data sets is under 3 pages long, and it's just an online click through. Just imagine the paperwork you would expect to get very specific mobility data from a private sector company, and that it's only 3 pages. But even better, what we can offer is, we have a network in the case like CrisisReady, where when we can go to our over 700 already established partners. And this is really taking advantage of that, worldwide moment during COVID that built this out. And we can say, look, we have people, they have code that they can share, and they have experience utilizing our data sets, and they understand the strengths, weaknesses, and biases in these data sets, and we can connect you to them as well. And so we can very rapidly build that human network that is centered around the initial ask is the thought is the data, but very quickly we are assembling the people and those established relationships, or form new relationships to respond. So it helps us, it becomes a triangle. The data provider is not sending it directly to the government in most cases, but I think the value add of that personal layer and the ability to bring in the local insight is well worth the added cost of scalability.
How do you work offline?
Pardon?
How do you work when you're offline?
So some of the data sets are just derived from satellite imagery, so those are baseline. But yeah, when the networks are down and things, it is just empty to us. So there's no way for us to circumvent those limitations.
Thank you. In the interest of time, we're going to borrow from question hour in the AI section, so save your questions when they're doing Q&A. But I'm just going to respond to the last question you had about the interconnectedness of data sets. Something that Andrew, Caroline, and I have been talking about, which I'm sure Celine and Taka will agree with here as well, is the question to ask is not what do you want to know, but what do you want to do? And the moment you sort of sit with an agency or a local community and say, what do you want to do? Which 2 dashboards need to talk to each other, or what APIs you need becomes a lot more clear than taking on the task of working with all these platforms and trying to make everything talk. I mean, to what avail, right? Thank you very much for a compelling panel. Thank you to all the 4 speakers. Thank you, Taka and Caroline, for joining. And over to you, Andrew, to the next session.